What is trigeminal neuralgia? Trigeminal neuralgia is a very painful disorder affecting the trigeminal nerve. This is one of the ones that supplies most of the information to the face, not just for sensation, but also for motor functions like biting or like chewing. Trigeminal neuralgia is usually a chronic problem, and it comes in these episodes where it'll be on and off, sometimes for weeks or months at a time, and then it may go away for no real known reason. However, the pain, when it does happen, can be excruciating, and it's commonly called a suicide disease. Some of the most common things that will happen for patients with trigeminal neuralgia is they're going to have difficulty with chewing, they're going to have difficulty with swallowing, they're also going to even have difficulty just drinking cold water, and for many, even washing their face, combing their hair, having a shower. All of these things will be excruciating and very difficult because of the sensation that will happen from any of these what would seem to be more innocuous movements. There can also be a less severe version called atypical trigeminal neuralgia. This is not going to be quite as painful, however it's going to be more a burning sensation, and usually it's going to last for a much longer time, still again going around the face. Trigeminal neuralgia can be due to different causes. This may be a growth in the area, such as a tumor. It may be compression in the area because of blood vessels, or it may be due to inflammation. However, all of these are all compressing on the nerve. The main thing we need to understand with this problem is its compression of the trigeminal nerve. That is what is causing the issue. Another cause that we see very commonly here in the practice is misalignments of the joints at the top parts of the neck. This can start to influence the nerves that are running through the area, or it can start to influence the brainstem, and it can start to influence some of the areas in the cranial nerves which send the information around to the face. And one thing we need to remember is the trigeminal nerve is a cranial nerve. Treatment for trigeminal neuralgia is usually going to start with some level of medication. This may be painkillers, however it may not be some of the painkillers or even some of the other medications you may think of. Even strong things like opioids usually don't respond very well to trigeminal neuralgia. We usually have to look at other types of medications, whether it's antidepressants like amitriptyline, or maybe even starting to use anti-inflammatory drugs. These can sometimes be more effective, but in some cases this may be short-lived. If medication continues to be used and it's not being effective, this is where doctors may recommend surgery or ablation of the nerves through the area. However, this can also lead to some other side effects, such as numbness in the area or even affecting the motor function, so someone may not be able to chew properly after having these surgeries. Here at Vitality Chiropractic, we see a lot of cases of trigeminal neuralgia. We actually have 2 studies coming out which are going to be published this year about our patients who had positive effects with our care for their trigeminal neuralgia. The patients that see us have typically already tried medication, some have even already had surgery, and then we see if there's another approach which may be better for them. We focus more on what's happening at the top part of the neck, improving the misalignments that may be happening in their spine that put pressure on those nerves, particularly affect the trigeminal nerve. When this happens and that pressure is off, that's where the symptoms can reduce down over time and people can get back to their normal lives. If you suffer from trigeminal neuralgia, comment below or follow us for more information.